Stick out your tongue and look at it in a mirror right now. Go ahead, I am serious. Because in the next 20 minutes, I'm going to show you 6 things on that tongue that can quietly warn you about what is happening inside your body, from your blood to your circulation to your nerves, often long before a standard test would catch it. And most people, including many busy doctors, walk right past every one of them. I am Dr. Okoro, and on this channel, I take what the medical research actually says and turn it into simple things you can check and use today. Everything I show you is grounded in published science, and I will point to it as we go. So keep that mirror handy, get some good light on your tongue, and let us start with the color, because color is where the biggest clues hide. Sign number 1. Look at the overall color of your tongue. A healthy tongue is a fairly even, medium pink. What I want you to look for first is the opposite of healthy pink. A tongue that looks pale, washed out, whitish, or drained of color, especially across the main body of the tongue. Why does that matter? A pale tongue is one of the classic visible signs of anemia, a shortage of healthy red blood cells or the iron and nutrients that build them. Here is the connection. The rich pink of a normal tongue comes from a dense bed of tiny blood vessels sitting just under a thin surface. When your blood is low on red cells or on the hemoglobin that colors them, that whole surface loses its rosy fullness and turns pale. And this shows up on the tongue early, because the tongue's surface is thin and its blood supply is generous, so it reports changes in your blood before you might notice them anywhere else. Now, why does a heart-focused channel care about anemia? Because anemia makes your heart work harder. When each drop of blood carries less oxygen, your heart has to pump more and faster to deliver the same amount to your body. Over time, in an older adult, that extra strain is hard on a heart that may already be under pressure. So a pale tongue is not just about tiredness. It can be a signal that your heart is quietly carrying an extra load. If your tongue looks noticeably pale, and you have been more tired, short of breath, or dizzy than usual, that is a reason to ask your doctor for a simple blood count. Note it, and let us look at the sign that matters most for your circulation. Sign number 2. This is the most important one on the list for your heart, so look carefully. I want you to check for a tongue that has a purple, bluish, or dusky tint to it, rather than a healthy pink. The medical name for a bluish tint in the tissues is cyanosis, and on the tongue it is a serious signal. Here is why. That blue-purple color means the blood reaching your tongue is low in oxygen. Bright, well-oxygenated blood is vivid red and shows through as pink. Oxygen-poor blood is dark and bluish. And when it pools in the fine vessels of the tongue takes on that purple, dusky look. Think of it like the plumbing in your house. When fresh pressurized water is flowing, everything runs clear and strong. When the flow is sluggish and the water sits, it goes stagnant and dark. A purple tongue is stagnant, oxygen-starved blood showing on the surface. And what starves blood of oxygen or lets it pool? Problems with the heart and the lungs, poor circulation, heart failure, chronic lung disease, or low oxygen from something like sleep apnea. Research looking at the small vessels under the tongue has even used them as a window into the health of a person's whole circulation. So if your tongue looks genuinely purple or blue, not just stained from a popsicle or a glass of red wine, and especially if you also feel breathless or your lips look dusky too, please do not wait on that one. That is a same-week conversation with your doctor, and if it comes on suddenly with shortness of breath, it is an emergency. Check your color now. Pink or a worrying purple? Good. Let us go to sign 3. Sign number 3. Now look at the texture and the surface. I want you to check for a tongue that looks bright red, smooth, and almost glossy, as if the normal slightly bumpy texture has been polished away, leaving it shiny and sore-looking. This has a name. Doctors call it glossitis. And a smooth, beefy red tongue is a classic sign of a deficiency in certain B vitamins, particularly vitamin B12, folate, and iron. Those little bumps on a normal tongue, the papillae, need a steady supply of these nutrients to stay healthy. When B12 or folate runs low, the papillae flatten and disappear, and the tongue becomes smooth, red, and often tender or burning. This one matters a great deal after 60, and it ties directly to something I have talked about on this channel before. B12 deficiency is common in older adults, and it is especially common in people who take certain long-term medications, including some for acid reflux and the diabetes medication metformin, which can lower B12 over time. And low B12 does not just show on your tongue. It damages your nerves, causing the numbness and tingling in the hands and feet that so many seniors struggle with. So a smooth, red, sore tongue can be an early flag for a deficiency that is also quietly affecting your nerves and your energy. The good news is that this is one of the most treatable things on this entire list. If your tongue looks smooth and red, ask your doctor to check your B12, folate, and iron levels. Note it down. On to sign 4. Sign number 4. Look now for a coating on your tongue. specifically a thick, white coating that looks almost like a layer of paint or cottage cheese sitting on the surface, one that does not simply brush away. A thin, light coating is normal. A thick, white coating that keeps coming back is worth attention. The most common cause is an overgrowth of a yeast called Candida, an oral thrush, and here is why it matters for you. That kind of yeast overgrowth tends to take hold when the body's defenses are down or when there is extra sugar to feed it. In older adults, a persistent white coating can point to a weakened immune response, to dry mouth from medications, or, and this is the important one, to blood sugar that is running too high. High blood sugar feeds yeast, which is exactly why recurring oral thrush can be an early visible clue of undiagnosed or poorly controlled diabetes. So a thick, stubborn white coating is not just a hygiene issue to scrape off and forget. If it keeps returning, it is worth asking your doctor to check your blood sugar and to think about why your mouth has become a welcoming place for that yeast. Scrape gently and look. Is your coating thin and normal or thick and persistent? Note it, and let us look at the edges of your tongue. Sign number 5. Look at the sides and edges of your tongue. I want you to check for a scalloped or wavy edge, a series of gentle indentations along the sides, as if your teeth have pressed little scallops into the rim of the tongue. This happens when the tongue is slightly swollen and enlarged, so that it presses against your teeth and takes on their imprint. What makes a tongue swell like that? A few things worth knowing. One common cause is fluid retention, the same kind of fluid buildup that can come from heart or kidney strain, where the body holds onto water and the tissues, including the tongue, become puffy. Another well-recognized cause is an underactive thyroid, hypothyroidism, which can cause tissues throughout the body, including the tongue, to swell. And a scalloped tongue is also strongly associated with sleep apnea, because an enlarged tongue that crowds the airway is part of what causes the breathing to stop during sleep. And untreated sleep apnea, as I have discussed before, is one of the most powerful and reversible risk factors for high blood pressure, heart rhythm problems, and stroke. So those little tooth marks along the edge of your tongue can be a quiet thread that connects to your thyroid, your fluid balance, and your nighttime breathing, all of which touch your heart. If you see a clearly scalloped edge, especially alongside snoring, daytime fatigue, or swelling elsewhere, that is worth raising with your doctor. Check your edges. Smooth or scalloped? Good. Now the last sign, and this is the one I most need you to take seriously. Sign number 6. Look carefully at the whole surface of your tongue, the sides and underneath it, for any sore, ulcer, lump, red patch, or white patch that does not heal. A mouth ulcer that shows up and clears in a week or two is usually nothing. We all get those. But a sore, a lump, or a discolored patch that has been there for more than 2 to 3 weeks and is not healing is different. That is the one I want you to act on, because a persistent, non-healing sore or patch on the tongue can be an early sign of oral cancer. And the critical, frightening thing about early oral cancer is that it is very often completely painless. People ignore it precisely because it does not hurt. The risk is higher in people who smoke, who drink alcohol regularly, or who have worn poorly fitting dentures for years. So here is the rule I want you to remember and never break. Any sore, lump, red or white patch or rough area on your tongue or in your mouth that is not healed within 2 to 3 weeks needs to be looked at by a doctor or a dentist. Not watched for another few months. Looked at. Caught early, oral cancers are very often highly treatable. Caught late, they are not. Check your tongue now. Top, sides, and lift it to look underneath. Anything that has lingered? If yes, make that appointment this week. So those are your 6 signs. Before I give you what to do, let me pull them together with the one idea underneath all of them. Your tongue is one of the most exposed, thin-surfaced, blood-rich, nerve-dense pieces of tissue in your whole body, sitting right where you can see it in a mirror every single day. That is exactly why it shows change so early. Its color reflects your blood and your oxygen. Its texture reflects your nutrients. Its coating reflects your immune balance and your blood sugar. Its shape reflects your fluid and your thyroid. And its surface reflects everything from infection to cancer. For thousands of years, physicians examined the tongue first, before any other tool existed. They were onto something. Modern research continues to find real correlations between what shows on the tongue and what is happening inside the body. Your tongue has been filing a daily health report your whole life. Today you learn to read it. Now the part I never skip because it matters more than any single sign. These are signs, not sentences. Not one of the 6 things I showed you is by itself a diagnosis. A pale tongue can come from a cold room or a light meal. A little coating is normal. A single ulcer from biting your tongue is nothing. These signs are meaningful when they are clearly present, when they persist, and especially when they appear alongside how you actually feel, your energy, your breathing, your other symptoms. So please do not stand at your sink tonight and frighten yourself. The right response to finding a sign is not panic. It is a calm note to yourself. Check it again in a few days, and if it is still there, bring it to your doctor. So here's what to do this week. 3 simple steps. First, take a photo of your tongue right now, in good light. This is your baseline. Tongue changes happen slowly, and without a starting picture, you will never notice the drift. Once a month, take another and compare. Second, if you found a sign of the deficiency type, a pale tongue or a smooth red one, ask your doctor for a simple blood count and to check your B12, folate, and iron. These are cheap, ordinary tests, and correcting a deficiency can transform how you feel and take a load off your heart. Third, and this is the firm one, if you have a purple or blue tongue, or any sore or patch that has not healed in 2 to 3 weeks, do not wait and watch. Those 2 get a doctor promptly this week. Let me give you the 6 signs one more time, quickly, so they stay with you. 1. A pale, washed-out tongue, a possible sign of anemia that makes your heart work harder. 2. A purple or bluish tongue, a warning of poor circulation or low oxygen, the most important one for your heart. 3. A smooth, bright red tongue, a classic sign of B12, folate, or iron deficiency that also affects your nerves. 4. A thick, stubborn white coating, which can point to a weakened immune system or high blood sugar. 5. Scalloped, tooth-marked edges, linked to fluid retention, thyroid trouble, and sleep apnea. And 6. Any sore or patch that will not heal in 2 to 3 weeks, the one that must be checked without delay. 6 signs, all visible in a mirror, all worth a conversation with your doctor if you find them, and none of them, on their own, a reason to panic. If you looked at your tongue while we went through this, do me a favor and tell me in the comments how many of the 6 you spotted. 0, 1, 2, or more. I read them, and it genuinely helps other people to see they are not alone. And if this taught you a way to understand your own body that you had never been shown before, consider subscribing, because that is the whole reason this channel exists, to give you simple, honest tools to look after yourself. Take good care, keep that mirror handy, and I will see you in the next one.